My name is Dr. Daniel. I'm a general practitioner. I have a certification in Regenative Medicine and metabolic control. The way it works is because the stem cell has the ability to induce the body to produce brand new blood vessels. So basically, we're doing some improvement over the blood flow of the tissue, which is the cavernous bodies of the people. We do stem cell therapy with umbilical cord and also adipose tissue because those lineages of cells are the best lineage of cells to treat this specific condition. They can stimulate the body to improve the blood flow, but also they can modulate the immune system. We need to know that the patient is a candidate. Of course, there's some criteria. Then, after that, the process, it goes up to the operating room, which is a place that we're going to perform the procedure. It has to be with technique and the certified personnel. Basically, patient starts with natural erectile. They also feel other outcomes like they can improve the sleep habits, they can improve the appetite, they can improve the energy. Mainly, we need to know if the patient has any other disease or condition like diabetes or high blood pressure. They have to be under control because otherwise it can be considered as a restriction. The patient that has stem cell therapy, they can develop fever syndrome. They can develop fever and symptoms pretty similar as a flu. Okay, so what we need to manage here is a symptom. One of the possible complications is that the patient can see some bruises over the spots that we use to inject the cells. Patient, they can also develop some red areas, but that's okay. Actually, sometimes can be good sign-off because remember that we need to improve the blood flow. First of all, the patient, he needs to continue with the main neurologist, and we're going to recommend to continue with some medications that the urologists recommend because it is part of the process. Also, of course, continue with the healthy life. We have to give it a follow-up for every patient in regenerative medicine. I give it to the patient a follow-up after 2 weeks, and then after 3 months, and then eventually. This is because this is a very gentle science, but it is also unpredictable. So if the patient experiences some good progress, we can continue with the stem cell therapy, but after this specific time. This could be unpredictable results. We're dealing with something that is natural, so this is a biological product. Responding of the patients, it could be weeks, could be months, specifically in this area because this is a specified tissue. I cannot tell you exactly how long, but usually the biological cycle of the stem cell in the body, it takes 1 to 4 months until the body absorbs the cells and there's no any other stem cell in the tissue. So the patient can experience the outcome or improvement in between 3 weeks to 3 months. I do recommend the stem cell therapy in other conditions or diseases because we know that this is something natural. This is an alternative medicine, and this is something that is not going to cause any kind of side effects versus medications or other traditional medicine. I can also treat patients with other diseases or conditions like autoimmune diseases. I can also provide treatment protocols for patients who has autism. This is more direct for kids. I can do also therapies for patients with Alzheimer, Parkinson's disease.
What do you love most about your job, Dr. Daniel?
The positive results of the patient.